Good afternoon, everybody. Greetings. We are glad you are joining us again for our COVID-19 briefing for the Chippewa Valley, for Eau Claire, to get an update on what's happening with COVID-19, to get the basic data, and to share what's happening most recently. Today is Monday, August 17th. I hope that as fall approaches, people are finding ways to get outside and enjoy our fun weekend time and our times to be together with one another. We also know that this time of year there are many questions about schools. This is the time that our K through 12 kiddos go back to school, as well as our young adults that are going to higher education. There are many unknowns at this point with schools, and we are glad that we have an ongoing conversation in our community as we are trying to walk together forward through COVID-19 and school starts. And that has been a strong community experience to be working with one another on making things happen. Our goal, like everyone's goal, I think, is that we have less disease happening in the community this fall, that we return to normal as quickly as possible and as safely as possible, and that our teachers, students, and staff are all able to safely teach and work and learn in our schools. Dr. Heidi Iliopoulos is here with us, Superintendent of Altoona School District. We're happy to welcome her to Eau Claire County as a new superintendent, and we've been thrilled to have her part of the team for responding to COVID-19. Heidi has been part of the work that we've done for Safe Return. She's been an active member of our superintendents group that are superintendents and leadership people from across the district, meeting regularly with our incident command team. And she's really been instrumental in supporting that ongoing collaborative work. So we're happy she's with us and sharing a bit with you today about what's happening in schools. I'll first give a state update on the data like we usually do, a bit about our Eau Claire data, and then Heidi will share a bit about schools, and both of us will be available afterwards for questions. Again, our state data to begin with. Negative tests for COVID-19 in the state are at 1,006,040, an increase of 5,500 since Sunday. Total positive cases for COVID-19 are at 66,196, an increase of 455 positive cases of COVID-19. Of those, 5,327 have ever been hospitalized, and we have 1,039 deaths related to COVID-19. Over the past 2 weeks, the state has on average had about 770 new cases per day of COVID-19. The positivity rate is over 7%, which is higher now this past couple of weeks than it has been more recently. Yesterday, the positivity rate was over 11%. We continue to watch that carefully as one of the measures that gives us an idea of what's happening with COVID-19 in our state and across the nation. In Eau Claire, our negative test numbers now are at 16,157, an increase of 354 negative tests since Friday. Positive cases of COVID-19, people in Eau Claire County residents that have had or have currently COVID-19 are 668, an increase of 22 since Friday. 4 individuals have died of COVID-related deaths in Eau Claire County, and 33 Eau Claire County residents have been hospitalized. 570 individuals are considered recovered, with 98 active cases of COVID-19. These past few weeks, like we've talked about before, we have seen an increased number of contacts for the cases that we are finding of COVID-19. Those contacts in some cases have been significantly over the double-digit numbers. My reminder to all of you is that we will slow the spread of this disease if we have smaller groups that we are interacting with in a close way, And if we reduce those contacts so that the spread stays slow, again, 6 feet or closer for more than 15 minutes are considered those close contacts. That's the most likely time frame that the disease will spread. On Mondays, we also share with you our jail data. As of this morning, we were still waiting for the result of one of the tests from our larger testing event at the jail last week, but all of the other 79 tests have come back negative. So we are awaiting one test result, and we will let everyone know when that is available. Good news that our testing of the jail staff and the jail residents has been to date negative from that event, and that is good news, I think, for looking at the policies and procedures that we've had at the jail and have been implemented by that leadership team. We will continue to watch that. The jail is a vulnerable population, and both the residents in the jail, those people that are in the jail, as well as the staff, are a group that we will be working with as Incident Command to continue to assure that the spread of COVID-19 doesn't happen there. In the jail to date, then, 131 individuals have been tested with 7 positive cases and 7 recovered cases. Again, those are not all Eau Claire County residents, especially the staff, are people that may reside in other counties. We are also today asking for some assistance in being creative about testing across our county. We have really strong healthcare partners doing our symptomatic testing in Eau Claire. We have additional testing that there is interest in our community to be done. We have a testing plan. The state has been working with partners across Wisconsin to find creative ways to incentivize testing, and we are interested in partnering on those creative opportunities to reach those that may need a test that can't easily get tested. So again, if you are interested in that opportunity, please contact us. You can call us via the call center line or email us. Just that quick reminder, our website is covid19eauclaire.org, and our call center is 715-831-7425. So now I will have Heidi come share with you a bit more information about schools, and then I'll be back and we can close out and answer questions. Thank you.
Good afternoon. Thank you so much for having me this afternoon to provide an educational update about the planning work taking place among the educational community right here in Eau Claire County. When the Safer at Home statewide school shutdown expired June 30th, schools, like other organizations, were still required to follow any order put in place in their county. Eau Claire County is a county with an order. This means any school within our county, public or private, is required to follow the provisions of the order. As planning teams from districts in the county have been gathering throughout the summer, we've used several resources to guide our planning. First and foremost, we've used our local county and guidance from local public health officials. Physical distancing of 6 feet between people has played a big role for schools during the planning process. Specifically in Eau Claire County, where the 6 feet isn't just a recommendation, but part of our order, schools have looked at how many students we have, what are our classroom sizes, what space and resources are available to us to spread students apart. In some schools, there isn't enough space to physically spread students out to establish that 6 feet of distance. That's why you may have seen some schools break students down into smaller groups and have them attend in person on a rotating basis. The circumstances in each school and community are different, and so plans are individualized by districts. However, especially in Eau Claire County, where we've had a highly collaborative relationship, you will notice some similarities among plans in order to establish high levels of health and safety. Measures that are common include temperature and symptom screening for staff and students, following the state mask mandate, plans for if a student or a staff member would begin to show symptoms throughout the day, increasing cleaning standards, hand washing and hand sanitizing processes, limiting school visitors and large-scale events, not sharing supplies or equipment, and a 100% virtual option. In addition to the state and local orders in place, schools have received additional guidance from local health officials and state organizations like the Wisconsin Department of Public Instruction. In Eau Claire County, like Liska mentioned, education leaders are collaborating with each other regularly, as well as meeting frequently with county health officials. Our collective goal is to establish high levels of health and safety standards while delivering a quality, responsive education and supporting social, emotional, and mental health needs. Even with the precautions, symptoms, and procedures that schools are putting in place, we know there are students or families with individual health situations or parents who simply aren't comfortable having their child go back to school at this time. For this reason, public and parochial schools in our county are offering fully virtual programs for their students. As we return to learning this fall, we're facing even greater challenges with equity. We're accustomed to students coming through our doors with a wide range of experiences, challenges, traumas, resources, and academic progress or slides. We're expecting those ranges to be even larger this year, as students will have been away from school and families away from school and school supports for over 5 months. Schools will continue our planning on how to support social and emotional needs of students, how to help students feel safe when they come back, and how to help them reform relationships, and how to focus in on the most important skills we need our students to gain. Additionally, we'll work to help families close resource gaps that they might experience during virtual learning times by connecting them to technology devices, internet access, school meals, and even counseling services. New information and guidance is continually coming out. We aren't entering the school year believing that our plans might change. We're going in knowing that at some point they will change. We ask for our communities to give all of our schools and school systems time and grace to adjust and communicate as this happens. We realize there are a lot of viewpoints, opinions, and emotions about the pandemic, as well as the coordinated responses to it. One thing that most of us can agree on is kids belong in school. The reality is that our ability to bring our students back to school, all of our students, all of the time, directly depends on the health of our community. So if you agree like we do that kids belong in school, we're going to need some help. If you agree like we do that our future as a community depends on the education and development of children today, we're going to need some help. And if you agree like we do that our local economy depends on workers being able to work, which depends on them being able to send their kids to school, we're going to need some help. Please help us by taking every precaution you can to keep yourself and the people you come in contact with healthy. We need our community to be healthy so we can get our kids back to school. Thank you.
Thank you so much for that, Dr. Iliopoulos. That is really at core what we can do together, that we being able to do the things that keep our community healthiest will be in a better spot. Our kids will be able to go to school, we'll have our businesses strong, and that's what we're all counting on. I want to thank our community for the work they've done to date. We have amazing partners and individuals in this community. Our disease spread has been slow. That's been our goal, and you guys all are the ones that are helping us make that happen, and we need that to continue to happen. The slower the disease spreads, the more likely we will be to make sure that we stay in school with our kiddos where we want them to be. So thank you for sharing that. I also want to say that we can be part of this next step. We can take steps ourselves to make a difference. And Heidi talked about that. So wear a mask, keep your circles as small as possible. Get out and keep yourself healthy. The healthier you are, the less likely you will to contract this illness and be very sick with it. Do those things that we all know we can and should be doing to be as strong as possible. One of those things this fall is getting a flu shot. We are knowing that this season is being predicted as a strong influenza season on top of COVID-19. So my encouragement to everybody is to also be planning now to get your influenza vaccine, to get your flu shot. It's something that we all should do every year. It will decrease your attack on influenza. You'll make it more likely that if you get ill, we know that it possibly is not influenza and possibly is COVID-19. It'll be easier to differentiate between those two diseases for those that are able to get an influenza vaccine. And getting a flu shot is a simple thing we can do to stay healthy. The healthier you are, the less likely you are to get very ill from another illness. So strong encouragement to get your influenza shot, to work with your healthcare provider to do that, and to anybody that is over 6 months to make that happen. So we are now available for questions if anybody has any questions. Yes?
You talked earlier about incentivizing testing and working with the state on it. Can you be more specific about what opportunities companies might have for asymptomatic testing? Is that something the county is pursuing right now?
So there are a number of things in that question. So the testing that we need done in Eau Claire County and across the state is primarily symptomatic testing. There is some asymptomatic testing that is also prioritized by the state. The state is working with counties and local health departments across the state to provide an incentive of $35 a test. It's not really an incentive, but it's a payment mechanism to add to other funding sources that may be available for those that are able and willing to make sure that COVID testing is happening in some of those places where we may have gaps in our testing. So we are working with our local plan to identify those gaps. We have been doing that with our partners, and we are working on making sure that testing is broadly available. The primary focus continues to be on symptomatic testing for all populations in our county.
Just a follow-up on that. You said that instead of possible incentive of $35 a test, would that be paid from the state? And if I'm understanding this correctly, would that be paid to the person who's receiving the test?
So the question related to testing, we are working with the state. They have a pot of CARES dollars available to go to providers to give tests to individuals to make sure that testing is happening of individuals that are symptomatic in coordination with the health department. That payment model information is available on the state website is for providers of tests in order to get to make sure that testing is happening. Yes.
So some people think that getting the flu shot, can help fight against COVID. We know that there's not a vaccine yet, but is that something that the health department has found that the flu shot can help fight against COVID?
So this is a follow-up question to influenza. Do we have information that getting a flu shot can help fight against COVID-19? There is not a direct link between COVID-19, the disease, and influenza. They are different diseases. What will help is that every year we have people that get sick and die of influenza across the nation and in our community. The fewer people that get influenza and get very ill and die are fewer people that are hospitalized, and that will impact our healthcare system and make it more available for those that may get ill with COVID-19, a disease that we don't have a vaccine for right now. The goal is to have as many people vaccinated for influenza so we have fewer illness. Having fewer illness will help us in our community take care of those that may get COVID-19 this fall and winter. Other questions? All right, thank you very much. We are happy that you joined us today. We will be back on Wednesday like we usually are to do our Facebook streaming event. That's an event where we answer questions of the media, and we are looking forward to talking to you then. Again, check our website out, covid19eauclaire.org is updated every day, and the call center number, 715-831-7425. Thank you.